Alright. Good evening, classmates and instructors. My name is Butler, and today I'll be talking to you about the treatment of fibromyalgia. Here's a brief overview of what I'll be going over. We're going over the background, my research design, the results, and the conclusion of the study. A little background on fibromyalgia. So it's a musculoskeletal disorder, and what musculoskeletal means is that it's a disorder that really affects your bones and your muscles, so it can cause a lot of pain there. And this disorder, it can cause a lot of effects with your pain in your body. You feel fatigued a lot. It's like walking around, or doing a lot of activities such as sports or something. You can feel very fatigued in your muscles and such. Sleep disorders such as sleep apnea. You might not be able to get so much sleep because you're tossing and turning in your sleep, and you're just hurting, and your bones are aching really bad. So you're not going to sleep at the normal time that you would. So basically in this presentation, I'll be going over various procedures and treatment methods for fibromyalgia. I will now be going into my background. A brief little fibromyalgia history. Around right now, 3 to 6 million people are affected by fibromyalgia, and it is mostly found in women, not usually young girls, but women. And it's a lot of times neglected in children because, imagine you're a parent and you have a child and he says, "Oh mom, my arm hurts," and something like that, "My elbow hurts." You're not really going to overreact about it because, kids get hurt all the time, they trip, they fall. You're not just going to overreact all of a sudden. And this has been studied since the 1800s, and it's had so many names because fibromyalgia is not really a big problem. It's just more of just pain, and when doctors diagnose fibromyalgia, they don't really when people come in, they're just "Oh, I'm having pain in all my joints and my muscles and stuff." They're just "Oh, fibromyalgia," because there's not really anything that causes fibromyalgia that they know of. So the only main thing that they know that causes fibromyalgia, their little, thesis is that your weight. So if you're a heavier person, your joints and your muscles hurt a lot more, maybe because you have a lot more fat on your body. And in 1976, the decision was made to actually give fibromyalgia the name fibromyalgia. And in this picture, you can see all the effects that fibromyalgia can cause, and that's the guy with fibromyalgia. So some symptoms of fibromyalgia, like I said in the previous slide, were pain, sleep complications like sleep apnea, fatigue, so playing sport, or if you're just walking around or running quickly, you just feel out of breath, you're just hurting and everything. And irritable bowel and bladder, so your stomach hurts a lot and you feel like you have to go to the bathroom, or you can't control having to go to the bathroom a lot. So treatment, usually they give prescribed medicines such as milnacipran, sodium oxybate, duloxetine, and pregabalin. This is a picture right here of milnacipran, and it is a serotonin norepinephrine reuptake inhibitor, and in the USA, it has not been approved by the FDA, the Food Drug Administration, to actually be treated for major depressive disorders. This is a picture of sodium oxybate, and it's used to prevent attacks of cataplexy in people who have narcolepsy. And duloxetine is a drug that is used to treat depression, but in some cases it can also be used to treat pain, so that's probably why it would be used to treat fibromyalgia. Pregabalin, this relieves pain that was due to damaged nerves from injury or diseases. Now I'll be moving into the research design done by me. So their purpose was to to look at previous records of prescribed medicine that was used to treat fibromyalgia and whether or not, like, the number of drugs given will affect will affect the severity of your symptoms. And a little kind of purpose that I made up from my purpose for learning this experiment was to find out more about fibromyalgia and learn what it actually was, and to see what ways are the best for treating it. A hypothesis that I made up myself was I believe that now I believe that none of the prescribed medicines will be good for treating this disorder. I believe that they will, because I don't feel that they're going to actually permanently get rid of the pain, but just as more of just temporary, pain's gone for a while, but it will eventually come back if you stop taking the medicine. And I believe that a healthy diet and exercise would be the best way for getting rid of this, because like they said, their kind of thesis was that the weight of your body is actually the cause of fibromyalgia. The materials used in this, they just used the treatment regimen data and the 4 prescribed drugs. So the methods for this, they took the information of the treatment regimens retrieved from the SDI Health PDDA, which PDDA stands for Prescribed Drug. I forgot the word, but I know that A stands for audit. And this information is from 2009 to 2010. And their database captured information on disease states and associated therapies. These are my results, and a little bit of the results. So it showed basically the people treated with just one drug. There were more people that were just treated with one drug. So this is kind of like a summary of the doctors who prescribed medicine to the, ill patients. And you see there's more people who are prescribed with one drug, which probably means that one drug it's more commonly used. It probably means it has the better effect, because, 3 drugs might give more of might be more, but it might give the exact same effect as what one drug would do. So it's useless to give 3 drugs, and it's probably more cost effective to just use one drug if it's going to do the exact same thing. My results continue. So out of the information they took out of the database, 2% of people were affected by sleep, with sleep disorders. 8% of people had a muscle relaxant, to use to treat their muscles. 25% of people had pain, a lot of pain. 46% of people had an antidepressant to help with their depression, about maybe how they thought about them being heavyweight, or just the pain that they're feeling, not being able to get sleep, doing bad in their job and things like that. And 35% of the people had epilepsy, which I didn't even know so much about, that epilepsy was so involved with fibromyalgia. So the significance was we were able to serve that the 3 out of the 4 drugs were better for treating fibromyalgia, and the best one was pregabalin. It was prescribed the most. Most doctors prescribed pregabalin. So when you saw from my previous results, that one drug was most likely pregabalin because it's mostly prescribed. Second was duloxetine. It was the second most prescribed by doctors, so it's probably also part of that 82% of one drug prescribed. So now on to my conclusion. To sum it all up, we now have the knowledge so we can treat fibromyalgia in the future, and we know that the number 1 way for prescribed medicine to treat fibromyalgia is pregabalin. And now I think that a limitation of this research was they just showed one approach on treating fibromyalgia. So like I said, a healthy diet. They could have probably compared it to a healthy diet and the prescribed drugs. And these are my acknowledgments. research, they said that this information was like the news information, so there probably weren't any, I could look back over and get back to you on that, but in my research, this was like the news information from like 2011. So I mean, maybe in the past year they might be more, but as of right now, what I know is probably about, that's just not true. Yeah.
So since Clarabelle was the most prescribing it, was also the most effective ingredient then?
Most likely, I mean, if 82% of doctors would prescribe that to the patients, that it's probably, like, if one drug was treated mostly, and pregabalin is the most prescribed drug, then yeah, it's probably the most effective. Mr. Reed?
Yes, Mr. Brewer, thank you. Pregabalin may be the most prescribed drug. What are the success rates with that drug? Is it success in curing fibromyalgia, or is it just helping the patient to tolerate the effects of fibromyalgia?
It never really, you really don't cure it, but it kind of like relieves a lot of the symptoms. So like you don't feel the pain as much. You're not like as sensitive to pain. You might be, so since you're not as sensitive to pain, you can go to sleep like on time, and what you normally do, you feel better. Dr. Nip?
Was there, in your reading, was there anything mentioned about other modalities of treatment other than drugs?
No, and that's what I also said about a limitation, is that I feel like they should have, like, they could have, like, compared it to a healthy diet or other means of treating this drug, or this disorder. So that wasn't covered in my research, but I could probably, put it on our points. Mr.
Mr. Brewer, you mentioned that it was very prevalent in women, but not prevalent in girls. And immediately after that, you mentioned that young people who complained of pains were often ignored. Was that a suggestion that perhaps young girls do experience fibromyalgia, but it's just not diagnosed? Or what was the purpose in connecting the fact that women get it, the pros don't, and then immediately going to talk about how children are affected?
There was supposed to be a relation in that, because I feel that there might be a lot of young girls who are affected by this disorder, but it's just overlooked a lot, and they have the exact same, like, they're counted as women too, but they said that young children and girls do not get this as much, and probably just because it's overlooked in children.
Is that your conception, or is it?
That's my conception.